Hello, I'm Amelia Reynolds. The Chief Executive of the Mental Health Trust for Norfolk and Suffolk has tonight denied a cover-up of a highly critical report. Staff were surveyed last year after the service underwent a complete redesign. They spoke of individuals handling more than 60 cases at a time and of a culture of bullying. And perhaps most worryingly, of fatalities going up. In a moment we'll hear from the Chief Executive, but first this by Nikki Fox.
In this report, staff describe being burnt out by change. It's a trust previously deemed unsafe by inspectors, the first in the country placed into special measures. But a year after the report's author spoke to workers, has anything improved? One member of staff told me it hasn't.
Clinically, I don't think things are any better. We're still getting far more patients than we have the staff to deal with. We're not hearing anything from senior management that they even have an understanding of that, never mind a plan for how we're going to deal with the situation. It just gets worse and worse.
The report also highlights staff concerns about patients. One says we've had to do police welfare checks on people, and you sit there for an hour, and we all sit there waiting, thinking we're going to have another body on our hands. Campaigners tried to get the report published in December. The Trust refused. Then it was raised by the Norwich South MP during Prime Minister's questions.
Will he join me to call for its publication? Prime Minister.
This morning, it was finally made public.
There are bad management practices that have been going on. The Trust is in special measures, but let's not forget they're being exacerbated by a large amount by the cuts, the £80 million of cuts that would have taken place.
And it's funding pressures that have led to even more services cut, like the patient helpline. Staff understand budgets are tight, but say without transparency, their concerns aren't being heard. Nikki Fox, BBC Look East.
Well, earlier I spoke to the Chief Executive of the Trust, Michael Scott. I asked him why he hadn't made the findings of the report public sooner.
We checked with staff whether they were ready for the report to be released, and they said yes. That's why we've released the report. The important thing is we've made changes based on what staff said.
Nothing to do with the fact that it was raised in the House of Commons yesterday, then?
We asked staff over 2 weeks ago whether they wanted to release the report. Certainly that hastened our decision. Of course it did, but we had this in train long before what the events in the House of Commons.
But if you invite staff to come forward anonymously with their concerns, what is the problem with making public their concerns, which are anonymous?
Well, we have made it public, but what's more
Only
important...
now, since this pressure.
But what's more important is that we've actually made the changes. So it's not been a secret.
Do you appreciate, though, how it may look? Because it looks like the Trust has kept under wraps some highly critical comments about what's going on.
Last December, we took the results of this report to our public board. It's on the web, you can see that report. It was informed by the conclusions of the report, so we haven't kept it secret. More importantly, we've made changes in the organisation. So what we've done is invested in staff. So in community teams, we've put £1 million into extra staffing. That means caseloads are more manageable, people can get more attention. We've put £2.5 million into safe staffing on our wards.
You might also potentially have to make £36 million worth of savings over the next 4 years. In the light of what your staff have been saying, do you really think your Trust can cope with that?
That figure is an absolute worst case. Our job, my job, is to campaign for better funding for mental health services. If we get funding into the Trust, then we won't have to make those levels of reductions.
Michael Scott, thank you very much.
Thank you.
Well, if you've got any experience of the Trust, either as a member of staff or someone who's been supported by the service, then we'd like to hear from you. You can send us an email or get in touch via our Facebook page or on Twitter.